All right, listen. Autonomic pharmacology can feel like a maze. Alpha, beta, muscarinic, nicotinic, everything blending together. By the end of this video, you won't just memorize tables. You'll understand exactly what each drug does, where, and why it matters for step 1. Imagine I'm sitting next to you in the library the night before the exam. Let's make this simple. Big picture first. Autonomic pharmacology equals drugs affecting the sympathetic and parasympathetic nervous system. Two main branches. 1. Sympathetic, fight or flight, that is adrenaline mode. 2. Parasympathetic, rest and digest, that is chill mode. Main receptors. Adrenergic, alpha, alpha-1, alpha-2, beta, beta-1, beta-2. Cholinergic, muscarinic, M1 to M5, nicotinic, NN, NM. High-yield tip. Always ask yourself, sympathetic or parasympathetic, agonist or blocker, and where? Alpha-adrenergic drugs. Alpha-1 agonists. Alpha-1 agonists. They tighten blood vessels and raise blood pressure. Drugs. Example of alpha-1 agonists is phenylephrine, used as nasal decongestant and for hypotension. Mechanism. 1. Alpha-1 receptor is activated by adrenaline. 2. This turns on GQ, a messenger inside the cell. 3. GQ makes IP3, which releases calcium. 4. Calcium triggers smooth muscle contraction, leads to vessel tightens, leads to blood pressure rises. Bullet. High-yield clue. Causes pupil dilation without affecting lens. Alpha-2 agonists. Alpha-2 agonists reduce sympathetic outflow, which leads to lower blood pressure. Drugs. Clonidine is a alpha-2 agonist. Mechanism. 1. Alpha-2 receptor is on nerve endings. 2. Activating it reduces norepinephrine release. 3. Less norepinephrine leads to lower blood pressure. Step 1 tip. Can cause rebound hypertension if stopped suddenly. Alpha-1 blockers. Alpha-1 blockers relaxes smooth muscle, which leads lower blood pressure, so these can be used to treat BPH, benign prostatic hyperplasia. Drugs. Prazosin. Clues. First dose hypotension, relaxes prostate. Beta-adrenergic drugs. Beta-1. Beta-1 acts on heart, which increases heart rate, contractility, and renin. Beta-1 is divided into agonist and blocker. 1. Agonist. Dobutamine, which is used to acute heart failure. 2. Blocker. Metoprolol, which is selective beta-1 blocker, helps to protect heart. Beta-2. Beta-2 acts on lungs, vessels, uterus by relaxing smooth muscle. Beta-2 types are 1. Agonist. Albuterol leads to bronchodilator for asthma. 2. Non-selective beta blockers like propranolol can worsen asthma. High-yield trick. Beta-1 equals heart. Beta-2 equals lungs and smooth muscle. Cholinergic drugs. Muscarinic agonists. These muscarinic agonists activate parasympathetic nervous system, rest and digest. Some muscarinic agonists are bethanechol, which helps in bladder contraction, urinary retention, and pilocarpine, which helps in ciliary muscle contraction and used in treatment of glaucoma. Muscarinic antagonists. Muscarinic antagonists block parasympathetic nervous system. Some muscarinic antagonists are atropine, which increases heart rate, dilates pupils, dries secretions. Scopolamine, which helps to reduce motion sickness. Step 1 clue. Hot as a hair, dry as a bone, leads to antimuscarinic toxicity. Nicotinic drugs. Nicotinic drugs acts on NN, autonomic ganglia. These are rarely used clinically. And NM, neuromuscular junction, used as muscle relaxants. These can be divided as 1. Depolarizing blocker. Example, succinylcholine, used in rapid intubation, phase 1 versus phase 2 block. 2. Non-depolarizing blocker. Example, rocuronium, vecuronium, which helps to reverse paralysis by acetylcholinesterase inhibitors. Step 1. Integration. Pattern recognition. Hypertension plus BPH give alpha-1 blocker. Asthma plus heart disease give beta-1 selective blocker. Avoid non-selective. Urinary retention give muscarinic agonist. Glaucoma give muscarinic agonist or alpha-2 agonist. Remember, sympathetic or parasympathetic, agonist or blocker, which receptor, what effect? Final rapid review. Exam mode. Alpha-1 agonist, increased blood pressure, pupil dilation. Alpha-2 agonist, decreased NE release, decreased blood pressure. Beta-1 agonist, increased heart rate, increased contractility. Beta-2 agonist, bronchodilation, relax uterus. Muscarinic agonist, increased secretions, increased bladder contraction, decreased heart rate. Muscarinic antagonist, dry mouth, increased heart rate, mydriasis, constipation. Nicotinic NM blocker, paralysis. Nicotinic NN blocker, blocks ganglia, rare. If this helped you see autonomic pharmacology as a logical system instead of a messy table, drop a like so more stressed med students see it. Next, we'll connect this to cardiac pharmacology, where USMLE integrates receptors, drugs, and physiology. Remember, don't just memorize drugs, think mechanisms. That's how you win step 1.